Raw the Podcast is sponsored by Green Farm Juicery. Green Farm Juicery is a neighborhood juice bar specializing in cold pressed juice, smoothies, smoothie bowls, snacks, and is always all organic, gluten-free, and dairy-free. Green Farm Juicery makes in-house cold-pressed juices daily that are never HPP processed, so you can assure the highest form of nutrient density and health for longevity. You might have heard Melissa, the owner of the Bay Village, Ohio location, on season 1 of my podcast, where we talked all about the health benefits of juicing. Go back to listen to that and make sure to check out Green Farm Juicery in Ohio at their multiple locations. Everything is made on site and with love. Not only is it a great place to grab food to go that is healthy and safe, but they are also juice cleanse specialists, helping you kick off your new year right. Follow them at Green Farm Juicery Clee if you're local, and check them out today. Thank you, Green Farm Juicery, for sponsoring the podcast. Welcome back to Raw the Podcast. I'm your host, Allie, founder of TheCheekyClean and Conscious Cart, digital lifestyle brands for helping empower consumers to live more conscious. And I'm so happy and excited to be back in studio today with Dr. Mary Teague. Dr. Mary is a chiropractic physician and co-founder of Code Chiro with her husband, Dr. Chad Teague. Code's mantra and motto revolve around the concept that movement cures. She specializes in prenatal, postpartum, and pediatric care and takes a movement-forward approach to care and rehab. She is a chiropractic physician and has completed her Bachelor's of Science at Radford University in Virginia, where she also competed in the Big South Conference for women's soccer, Majorly Badass. She graduated cum laude from Palmer College of Chiropractic, Florida, and it was at Palmer where she started to take this interest in pediatrics, pre- and postnatal care. Dr. Mary is also a member of the International Chiropractic Pediatric Association and is currently working towards her pediatric diplomat. Am I saying that right?
Yeah, you said it great.
Welcome to the podcast,
Thank
Dr.
you.
Mary.
Thanks for having me.
I'm so happy. This is the first time that we've met in life. It's such a pleasure. I've heard so much about you from my close friend, Sammy. She is a patient of yours.
Yeah, you said it, not me. No HIPAA violation there.
Yes. She's been raving about your all services for so long. If you weren't on the complete opposite side of town from me, I probably would have been there many times already. But she was just like, oh my gosh, how do you not know Dr. Mary? She's the coolest. I'm like, I gotta start following her. And then I'm like, wow, you're so inspiring. I have kind of a high bar when it comes for inspirational people, especially in the area that I love to follow. And I love seeing your content every single day.
Well, I appreciate that because for me, when someone says inspiring, I'm like, thank you. That's not what I'm trying to do.
But that's what I love about it. It's super authentic.
Yeah.
You're just like doing your thing and sharing the journey, and it comes off like super relatable.
I can tell you right now, I am not good at faking it. I will not.
Love that. Well, then you're going to log great with me here at The Real Ass Word.
Good.
No, but it's so nice to meet you in life. I'm so intrigued to learn a little bit more about you. And of course, we're going to get into a lot of the work that you do and things like that. But tell me a little bit about how you got into wanting to be in the chiropractic field, right? So obviously as an athlete, you probably were pretty in tune with wanting to take care of your body. But I always say I'm so intrigued by people who are in the more like functional health space because it's not mainstream. So there's a reason why I'm sure you got to that field.
For sure. You would think that I was like always trying to take care of my body, but like, I mean, we touched on this a little before we started. Did not focus on my diet. I did not know, like, and I think you say those things now, you're like, gosh, if I would have just like, tried harder, knew what I know now. Yeah. But like, I mean, that's hindsight. But
totally.
When I was young and I competed in soccer and I mean, all the sports from young to whatever. But when I was in college, I mean, my diet was crap. I felt like crap all the time, and somehow I was still competing at like a high level. And so had never gone to a chiropractor before. I was biology major because I wanted to go to med school after I knew that. Like, I was like, I know that I'm going to grad school no matter what. Yeah. So I was like that nerd. I got injured a couple times, but it was when I ruptured my spleen my freshman year of college.
My gosh, that's a big injury.
It was pretty big. I
Yeah.
mean, I was in a soccer game. I like collided with the keeper. She broke her arm, but she broke my spleen. We didn't know that, but
Wow.
I was ended up in the ICU that night and for days, and then like 6 weeks I was not allowed to like do anything. I was on my back and just return to play was it just sucked. And like it was the first time I've ever experienced like back pain and just hip pain and like being stationary for that period of time. And like that goes to everybody that's stationary for their jobs and stuff like that. I could talk about that forever, but I didn't like the meds. I was like, I think I took one pain med and I was like, ew, how do people like this? How do people like this feeling? Even though, yeah, the pain was less, it was like I wasn't myself.
Fog and lethargic.
Yeah, like the word faded. I'm like, people are like saying about getting faded. That seems so stupid to me because this sucks.
Totally.
So I stopped taking them. Actually saw our team chiropractor, which is crazy because it was just like adjustments, like which we'll get into. Like an adjustment is really important, but it's just not like the end all be all. But that's all I was receiving, and I just felt so much better. And I just realized that there's just not necessarily. I didn't know I wanted to be a chiropractor at that moment,
Right.
But I just knew that maybe medicine wasn't the best path for me because it was all to me. It was like this isn't fixing anything. It's just covering things.
It's just band-aiding.
Yes, it's just like putting a mask over something and not looking at the ugly truth. And
Yeah. And you just like had this intuition where
yeah,
you're like, this isn't right.
And then I got injured again. I tore my ACL in my sophomore year. Again, pain meds, took it once. I was like, ugh, gross, I'm done.
Totally.
So it happened multiple times. And then when I was a junior, I was like, all right, this is when I actually need to figure things out. And that's when I went down that road.
Wow, that's so interesting. And it is so crazy when you think about, I guess it's not crazy, how easy it is for people to get hooked on that shit.
So to me, I'm like, I don't have like an addictive personality, but I could see how the feeling of no pain, like people, you have pain because I see how pain changes people's personalities. Like I'll have a patient come in, they're an 8 out of 10 pain. They have been for 6 weeks and they're just like not the nicest version of themselves. And like in 3 visits, they're like maybe down to a 4, but they're they're just nicer. Their personality is different. So think about taking a pill to get rid of that pain, and you feel better. So therefore you become addicted to the feeling of feeling better.
And it doesn't take long to hit that addiction.
Exactly.
Like, you like knew pretty soon in that you're like, I just don't like this feeling.
Yeah.
But there are other people that may not, even if they don't not like the feeling, they may be like, well, my doctor told me to take this, so I'm just going to take this.
Yeah.
And then like, a few weeks later, they can't live without it.
Yeah, withdrawal. Like you go off of it and you're like, I feel terrible. I need to take that thing that made me not like so that I don't feel terrible.
Yeah, it's really kind of just like goes back to how this medical system is very much like sick care and not health care.
Right.
And I think that's a perfect example of it, and how cool that you were able to kind of follow your intuition and instead of continuing down that, standard trajectory, you were like, I want to do something different and actually be in alignment now because it looks like from the content that you put out and the lifestyle that I've seen of you from a distance that you really have this all-encompassing approach of movement, food, chiropractic care, like body, mind, kind of whole dynamic in the care that you're able to provide to your patients.
For sure. I say it all the time. Listen, there's not a one size fits all. There's not a single thing that I could say that's what will keep you healthy, right? Like everybody's like, not everybody, I wish everybody was, but was striving for this like healthier lifestyle. Well, what can I do that will make me healthy? I'm like, well, shoot, I could do more things, you know? It's just, we just try to do anything that will elevate us the way we feel, the way we are personally in our lives, our relationships. You function better when you do those things. So,
absolutely.
And we just keep learning and adding.
And sometimes you don't know until you know. And when you do feel better, how you look back and you're like, how did I ever exist like that? I was a gymnast my whole life. And I look back at these like high levels I was competing at. And I mean, the shit that I was eating. And I'm
wild.
like, imagine if I was actually fueling my body as an athlete. Like, wow.
I would eat a Baconator.
Totally.
A Wendy's Baconator.
Yes, at like 9 p.m. after practice.
Yeah, or 2 hours before a game.
Oh my
God.
God.
Why do I feel so heavy?
Totally. It's so crazy.
So now
and
I'm
when
just
you're
not
young,
gonna
it's
eat.
like, yeah, oh my God, totally. I know. And it's hard. It's like you have to almost like learn these things yourself the hard way because we're not necessarily taught that.
Especially then.
Yeah.
Yeah.
Especially then.
Yeah.
exactly. Think back to even like what was available at school before practice. It's like it's not like us getting
Encyclopedias.
help. So that's like something cool where AI, it's like, you know what, maybe AI can help us in that
Helpful.
way. I like it.
Blessing and a curse. I'm all for it.
Yeah.
Like the stuff I ask AI versus I don't
Yeah.
know what everybody else is asking. It's insane.
Totally. AI is going to be like a full ingredient expert by the time this year's over.
It made my banana bread for me the other day.
There are really cool things about it.
For sure.
You know, and I think we always want to like fall back on this like fear-based mindset as a society in general, and AI is just another example of that.
For sure.
It can be of immense value. But okay, so you went to school in Virginia.
Yes.
Where did you grow up?
I was considered a townie. I was born and raised Radford, Virginia, a tiny little small town. It's like 15, 20 minutes away from Virginia Tech, Blacksburg area.
Okay.
And I knew, like, I was recruited when I was a freshman in high school. I committed when I was in 10th grade. I knew I was going to Radford University to play soccer. I already knew
Committed in 10th grade.
Verbal.
That's so badass.
Yeah. But it just was my journey. That's what I knew I wanted to play soccer. Loved it. I'm so competitive. I'm such a competitive person. In everything, but especially in that. But I like still loved it. Like I loved it the entire time. So
I love that.
Yeah. So that's where I was for my entire life until I went into chiropractic school.
Got it. And then your chiropractic school was in Florida.
Yep.
Cool. And where in Florida?
Port Orange, just like 20 minutes south of Daytona Beach.
Interesting. How was that change for you? Like, was it a welcome change?
So when I applied to chiropractic schools, I applied to there was five at the time, 5 Southern. I wanted to be within driving range of Virginia because I do love my family, but I also wanted a big change. I wanted heat. I wanted it to be warmer. So I applied to all those schools and I got into all of them and I went and visited every single one. I went to Palmer. Palmer was brand new. Like it was their second campus. It was brand new. It was high end. It was beautiful. It was 3 minutes away from the beach. You know what? I'm going to study for my stuff on the beach. Yeah. Let's go here. And that's kind of what I did.
That's so cool. I think sometimes, especially being from the North, it is so interesting to get out of the environment that you've always known your whole life and experience the value that can come from this other type of environmental lifestyle.
For sure.
Because then you can be more hyper aware of it when you do come back to an area like this.
100%.
That's how I felt living in California and now coming back. Even like going to Mexico the other week, I'm like, okay, I need to be so cognizant of the fact that it is harder to get the sunshine, the vitamin D, the circadian rhythm alignment here in the winter. So I have to do these other things, whether it's supplementing or walking enough in the day to make sure that I can still keep myself like aligned.
Getting that sunlight in your eyes. There's sunlight out today. Get
out there, get it. Totally. It's so powerful. It really is. And it was there that you decided to go into this pediatric pre and postnatal care?
Sort of. Like I would say that bio is like, yes and no. So like I didn't find my true passion for pediatric. Prenatal, I would say a majority of my stuff is prenatal and postpartum care now.
Got it.
For sure. Like, especially since I've had babies now, my passion really grew out of that.
Got it.
I was interested in it there. I got really into like movement-based stuff, especially because I met my husband while I was in school there.
In Florida?
Cool. That's where we met. I mean, we met each other in a gym. We didn't meet each other at school.
Oh, how funny.
People laugh about that. They're like, of course you did. Well, I mean, we're like-minded. That's how we found like-mindedness, and then that evolved. Like even the way we used to do things then, like it's completely evolved, and because knowledge keeps growing, all this stuff. I mean, shoot, where we were then versus where we are now, it's just every single year we just elevate. So,
and he's in alignment with that with you.
Yes,
for sure. And I think that goes such a long way in finding the right fit for you. So how did you guys decide to move to Cleveland? You from here?
No, technically, he's from Southern Ohio, so like closer.
Okay.
So I tell people he got dibs because he graduated before I did.
Okay.
And we considered, so I moved up here to do my externship. It's kind of like a residency.
Right.
While I was still in school, he had already graduated. He opened up out of probably, I know you referred to this as a storage closet or something like that.
My studio?
Yes. Yeah. He literally opened out of a shoe closet.
I love it.
So his buddy is Scott Panchek. Shout out Scott Panchek, Kristen Panchek. Is a CrossFit athlete, high-level CrossFit athlete, veteran. He's like the OG of all CrossFit.
Wow.
He still owns a gym in Mentor, Ohio. And Chad and him have known each other since Chad was in high school and college. They went to the same college. Really good friends. Scott was like, dude, come up here, open out of my space. Chad was about to accept a position in Southern Ohio. And I was like, go open up. You're too good. You're too awesome. Like, just go do it. And he was like, all right. So we did it. And he opened up out of that closet, and 9 months later, I moved up, and we opened up Co-Chiro in Mayfield Heights. And
so cool.
Yeah.
So neither one of you have ever really worked for anyone outside of like your residency.
No.
That takes guts.
To me, it was just like, that's what we're doing.
That's what we're doing.
For him, he was like, are you sure? Like, hell yeah, let's do it. I don't care. Like, I'm like, I want to do it.
I love it. Yeah, because as someone who has had more of like the secure path job to now being in entrepreneurship, it is such different worlds. And I have the utmost respect for people who are willing to take the risk and bet on themselves because it's a journey.
Yeah. I mean, shoot, the first 2 years, you understand why. I feel like I used to say this. I'm like, the system is designed to make you fail.
Yeah.
In the first 2 years. First 2 years, you want to buy something, you need a loan for it. It's like, all right, give us 2 years of tax returns. I'm like, but I've only been open for 6 months. How am I supposed to do that?
So
it's
crazy.
like, I don't get it.
You're just like figuring, because it's like school doesn't teach you entrepreneurship.
No, not at all.
So you have to learn everything the hard way on your own.
But mistakes. I mean, you make mistakes.
Yeah.
You learn from them. Hopefully they're not like put you under mistakes. We made a whole lot of mistakes. We still make mistakes. We still are just like, what do you think? What do you think? I don't know. Let's try it.
Got it. And you guys have been in the same location at Co-Chiro since? Or?
Yes. So we've been in that location almost 10 years now. Yeah.
Okay, cool. So tell the viewers a little bit about Co-Chiro in general. I was telling you beforehand that Sammy just, like raves about the space, and she does a lot of different things with you guys outside of just chiropractic care.
Right.
And I'm always seeing you guys like work out. Is there a gym on site? Like, give me a little overview on
all
the mission.
So when Chad and I founded Co-Chiro, it was based off of the mantra that movement cures. So rather than just like focusing on chiropractor, crack, adjustment, instead of that, we were like, well, I can adjust you every single day of the week and you'll feel better, but you won't stay better. How do we address the soft tissue? How do we address the movement that's behind that? Like, you sitting in your desk every day is what's causing this movement disruption. This is what's causing these chronic pain patterns. I'm not going to change your job. I'm not going to change your lifestyle, but maybe I can teach you how to do this on your own.
Yeah.
And that's kind of what we founded it off of. And then we dove into more like, we do a lot of soft tissue manipulation, like dry needling, cupping, grafting. We have a laser. We have shockwave therapy. We just kind of just go into anything that we know research supports and you actually see benefit from. And we just like dove in. And we were kind of like the only people doing it at the time. And then we were like, oh, well, we work out, so it'd be really cool to have a gym in this space, but it would also be really cool to be able to offer our patients, hey, this is a functional way for you specifically to train, rather than like,
so badass.
There's no one size fits all for training. I will say, no matter what, resistance training, if I had to do a hierarchy of all training, like yoga, Pilates, bar, like whatever you want to do, you need to do resistance training for the rest of your life.
Totally.
All the time. Like,
as a longevity
you
function.
have to do mobility. Don't get me wrong. They need to be coupled in. But if I had to do a hierarchy, regardless of what resistance training looks like for you, it could be bands, you know, like, maybe it's kettlebells, maybe it's barbell. I don't care. But resistance training for the rest of your life, because gravity is going to work on you and you got to combat that gravity pull.
Yeah. What type of mobility do you do as a supplement?
For me specifically, so I love hot yoga. Love it.
Love it too.
Love it. If I can't get to that, I hold myself accountable in terms of like a 2-minute stretch per side.
Yeah.
So I only do static stretching after, or just like, it's not a preamble to a workout, because I do active stretching, active mobility, activation before, and then like I'll do like 2-minute series of 2-minute holds on certain muscle groups in order to change the length of a muscle.
So cool. Okay, so we'll later in the episode we're gonna get into like your exact routine,
everything,
because I need to know like literally down to a T everything you're doing.
But it changes.
But that's good, you know. But I think just like coming to finding like what works for you is just so interesting to me. But in general, do you have? You're saying like one size doesn't fit all. So when someone comes as a patient, you're adjusting them, and then you're also like supplementing, recommending these other options that they can also do within your space, whether that's cupping, training, and it can kind of be this like package deal. And or do people do like a la carte, where like they may come for just a cupping session?
Yes, and yes. All of those are yes. So like, say typical new patient exams, or take out the word typical. New patient exam, do like the generic low back pain, right? Female, 38 years old. Let's do that. And everybody's back pain is different. It depends. Like, I mean, it could be, there's different things that cause back pain. It could just be a muscular spasm. It could be the way they're sitting in their car like this all the time. It could be, hey, they bent over, turned to the side, sneezed, and herniated a disc, and they're in acute low back pain, flare up disc pain. We call that a hot disc. So their treatment plan changes according to whatever their diagnosis is. But no matter what, everybody's receiving what's called flexion distraction. You get on a table, it opens up your spine, and it moves through range of motion by giving the discs a lot of nutrients. And also, it just feels good. Imagine your body just being stretched like an accordion and then just like moving through that range of motion. Yeah. Feels so good. But it's also necessary for everybody. All of us have spines. If we're alive, we have a spine, right? Yeah. Like, so we're bringing that spine nutrients. But then, say that low back pain was just a muscle spasm, me, myself, or whoever's treating them will do, depending on what they need, soft tissue manipulation to that area. So like, or the areas around it, or because you're going to do a biomechanical exam. You want to make sure that you know what tissues are involved. What do we need to lengthen? What do we need to strengthen? All of that is addressed. Got it. And then we create a plan around that specific person. Well, yeah, you're really going to benefit from this, but you'd also benefit more from like personal training to get this corrected. And you have personal trainers on site? Yes. One of our doctors is a personal trainer. And then we also have another personal trainer in the office as well. That's so cool. I feel like that is the piece that is, I mean, it's revolutionary that you guys have just put it together within one space, because that's the piece that's so hard, I think, for people to get that relief in the moment with chiropractic care, but then continue to strengthen your body around it and be able to live pain-free for long term really does come down to that movement. And a lot of times people don't know where to start or how to start. I mean, I have so many people tell me all the time, like, I'd love to go to the gym and lift like you, but like, I don't even know what to do. They're afraid to get hurt. Yeah. And they could get hurt. Yeah. You know, so to have someone kind of like guide them through it. Like, learn how to move well, have somebody that is very good at it and very good at teaching you, teach you first. Yeah. Do it for 4 to 8 weeks. Yeah. Feel confident in yourself. And then maybe you're able to go do it on your own. Totally. Or maybe you're able to go join a class. Yeah, or totally. Like feel confident in doing that. It's really about confidence too. It is. And learning. It's hard. Everything like comes with experience and awareness. Yeah. Yeah. Okay, so how old are your kids? I have a almost 2-year-old and I have a 4-year-old. Oh my gosh, that's so cool. Congratulations. Thank you. Did you guys know you always wanted to have kids? Yes. Okay. Yeah, I knew I wanted to be a mom. 100%. I knew I didn't want to be a mom right then when we got married, but and also we were just like in the thick of it with like the business. Shoot, we were poor, we were grinding. Like we didn't get home till after 9:30. That's when we ate dinner, go to bed, which by the way is not good for you, and then get up, do it all over again. Just me and him. Oh my gosh, wow. So, and if I ask you anything too personal, just let me know. Ask me. I'll be like, was the process of getting pregnant easy for you? So let's talk about more. Okay, so I want to say yes, because I can know how difficult it can be for so many women. A lot of my patients, personal friends, like I'm going to say yes. And I do think like you can be extremely healthy and it still be very hard. 100%. Yeah. I mean, cortisol levels, I mean, if you're even giving off an egg, who knows? Like all of those things are attributed to it. I will say I was worried about it. I was on birth control since I was 16. I was put on birth control when I was 16, the pill, because of ridiculously terrible symptoms. I was home 3 days of every month because I was puking and had cramps. Yeah. I had like medical leave from school. They didn't even count as like by days. Yeah. So they were like, you know what, how do we treat this symptom? We put you on a hormonal, like, let's just keep you the same all the time. Yeah. And I did that. And it fixed that issue. When in reality, if you look back, it's like, what if we would have tried this, this, and this? I mean, hindsight again. So I was on that until I got married. When I got married, I was like, you know what? I'm going to go off of it. I don't want to have a baby right now, but I'm also fine if we do get pregnant. God's will. So I didn't get my period back after I went off birth control for over a year. Ooh. Well, I got it back technically after about 6 months, but then it was irregular for another year. Yeah. It just shows you, like, I mean, my face, like my acne, like things, my body went, holy shit, what is going on? Shell shock. Truly. And I just remember just being so frustrated and like, I was going to go to a hormone clinic and like try to figure it out. And literally at 6 months, I remember crying because I got my period. I was like so relieved. I'm like,
Totally.
oh, I'm a woman again.
Yes.
Like, what?
Oh, and I just think like long term, while yes, it fixed the cramp situation, although like you said,
We didn't look at any other thing.
and we're not taught
And it's not
to.
it's not our fault. It's not our
Yes,
parents' fault.
exactly.
They're like, I want to fix my baby that's puking and like,
the doctor
crying.
offers that
Yep.
and says this is the way, you know, so it's totally understandable, but it's like then we're suppressing this natural cycle of ours for so long.
10 plus years. Yeah.
Yeah. And it's such a shock to your system when you do try to make that shift. So
Right.
it was about a year until you became regular again.
Yes. And then we didn't try or like not try, you know, until probably another year and a half after that. And I would say it was so much more regular at that point. And also the way I ate was better at that point. The way I lived my lifestyle.
But you gave your body time. I mean, even that in itself, I think sometimes people think like, okay, like I was like, I'm going to go off birth control and my ex and I are going to start like next month.
Yep.
And it's like,
No. I did 2.5 years before we started.
Yeah.
Yeah.
And it's
Even
like
trying,
you gave your body the time to reset and recalibrate and have normal, healthy cycles again. And I think that's something that's so simple but important for women is to like, if you do want to have children and everyone do you know, but it's like the sooner you can get off birth control and start to learn and track your own cycle, the better.
That's the other thing is like the knowledge of what your cycle actually is. I mean, when you were 16, you probably thought, oh, if I have sex, I'm going to get pregnant.
Totally.
No matter what.
Yeah.
Right?
I thought if a boy like looked at me.
You're my period's late.
That's what
I
we're
must
taught,
be
like,
pregnant. That is not how it works. It's
I
like
know.
there's only this small window during your cycle. And don't get me wrong, you totally get pregnant outside of that window, depending on weird ovulation, yada, yada. But if you can track those things very, very accurately now and like reliably. If you have a reliable cycle. And the only way to have a reliable cycle is to make sure your hormones are in check by doing all the things that you could possibly do.
Yeah. It's so interesting because in hindsight, I look back and my ex and I ended up getting divorced. And so obviously I didn't get pregnant, which was just a blessing because we weren't ready at the time. I wasn't getting pregnant right away, you know, and I was like, what the fuck is wrong with me? You know, and it was like a very depressing vibe because here I am, checking all the boxes of physically doing everything I think I should be doing. But there was this lifetime of stress and cortisol and irregular hormones that I didn't even realize until I, like you said, detoxed the birth control. And then I got to see my period on a regular basis. I learned so much about my body that I'm like, why were we not taught this as women ever in life before?
Did they know? I don't know.
People know to track the cycle. It's not rocket science.
But back I would say back when we were put on birth control. It was like,
but people are still getting put on birth control.
Nobody asked, but so many people, more people are asking the questions. They're like, how does this affect me in the long run?
True.
How does this affect my body's ability to do this? I mean, shoot. And then there's also like hormone disruptors. That wasn't talked about then.
No,
At least people are talking about it now.
Exactly.
Yeah.
I agree completely. For me, it was that simple thing of learning to know about my cycle that to this day helps me tenfold. Because if for some reason, like something's off in a month, I'm like, okay, what's going on? Like, I think it's such a vital sign as women to know our barometer of where our body's at in alignment. How often are women coming to you with hormone issues?
Hormone issues, I would say 50% of they're not necessarily coming to me for their hormone issues.
They just happen to have them.
We just happen to talk about because we talk about everything.
Yeah.
Like, I mean, they might have come in for low back pain, but I mean, maybe their low back pain is caused by dysregulation of this, and this. I would say women, 50% of my women have some underlying hormonal thing going on.
Yeah.
Especially cortisol. Cortisol is such a big thing. And if your body has this increased cortisol, your other sex hormones become like not important. So then they all get dysregulated and all that stuff. So I just try to educate on it. And the more I educate on it, the more power those people have to like
learn.
No, they just take power over you feel powerless when your hormones are not, when your body's not functioning the way that you expect it to. You feel powerless. So when knowledge is power in that moment, and if you know how to fix it, maybe it's not immediate, but you know how to fix it with these actions you're going to take, it makes people feel empowered.
And empowered is so crucial because I think the environments that we are exposed to now as women is so, it's like detrimental to hormones potentially. Everything from these hormone disruptors and all these products and the environment that we're being exposed to on a consistent basis and have since we were super young. I mean, I think back to like these Bath and Body Works products that I was like spraying all over myself for like a fucking lifetime.
Just walking into the store.
Which is how I feel in Sephora right now.
Green apple.
Oh my God, it's so bad. And it's like being so aware of like these things. And that's why I always talk about it, is because it's not just something that's in one ear out the other. It genuinely affects our bodies. And when you know more about it, you're able to do things to, whether it's detox or use different products or reduce your exposure, align your cortisol better. So talk a little bit about maybe ways that you would give your patients or the listeners and leveling their cortisol. I think that's probably something that I'm really hyper aware of hormone disruptors. I have a very like clean, toxic free lifestyle, but cortisol is something that is trickier for me. And I think as maybe like a high performer, entrepreneur, high achiever, I've like, my nervous system has been trained to run really high.
Yeah, your mental stress. Yeah.
Yeah. And I think that spikes your cortisol, right?
100%.
Yeah.
So the way I talk about it and the way I like come to patients with it is I talk about inflammation. Because first off, cortisol, you're supposed to have cortisol. Like levels of cortisol, like even having higher levels at some times is a good thing.
Right.
Like you're supposed to stress your body, right? I think about inflammation. I think about stress as it correlates with inflammation.
Got it.
And the way I talk about is reducing inflammation in your life through the things that you consume. There's different inflammatory things that you can consume. So like a diet, let's talk about diet. The mental stress, that's also an inflammatory marker that increases your inflammation, your mental stress, and how it relates to pain. And then the things you do to your body throughout the day. So like working out, the way you sit at your desk, the way you don't sit at your desk, the things you do throughout the day. So your outside factors.
Absolutely.
So that's how I refer to it. I refer to it as inflammatory or inflammation makers, right?
Got it.
And how do we lower that threshold?
Yeah.
So first off, I talk about diet. And like, even if I can't get you to like start moving more, at least I can start getting you to focus a little bit more on what you're putting into your body.
Totally.
Number one, and like I try to be as dumbed down as possible with it, because if you try to change everything in somebody's lifestyle immediately, it's immediately they put their guard up and they're like, what? And they're non-compliant.
It's like hard to stick to all these changes.
So much. That's why I say years and years. Like, every year it just gets better, right?
Yeah.
Just heighten it. But processed foods. Okay. A processed food. What is a processed food? Well, usually if it's in a package, it's going to be processed, but I understand packages are necessary for things. Like, I mean, this isn't a package, right? Like,
Totally.
So, like, the packages are necessary.
Yeah.
But I'm like, okay, well, how do we rule out more processed foods? Well, you could look at the word added sugars. If it has the word added sugars, and you just see it includes added sugars. And there could be other added sugars. I mean, they could consider honey or maple syrup. Like, those are added sugar. I'm like, oh, but those are fine. So reading labels, that's what I say about processed food. I'm like, read the label. If you don't understand 5 of the words, it's probably not a good thing to eat.
Exactly. It's like the label shouldn't be hard to decode.
Ever. It should be very easy to decode.
Yeah, you should know what the product is.
Yes. And then like if you get a package of meat, okay, which I don't care what meat it is, if there's a package and it says more than just salt and that thing, you're like, hey, why is there more stuff in there? And then you talk about preservatives. And I'm like, so these are inflammatory makers. These increase inflammation. And that's what I try to tell people. I'm like, just knowing more about the inflammation you're getting in from your diet. So that's where I start. I start with like processed foods. I go added sugars. I can go gums. You can go all of these other like, different types of sugars. Like,
yeah, because it is important to know that. And the reason why I'm always trying to share about different ingredients is because as we as consumers have learned more about these products that cause inflammation, the manufacturers have gotten more savvy.
They're good at it.
At hiding sugar or additives or preservatives under these words.
Or they're trace. They're so trace that they're under the limit on which they have to mention it. That's what's wild to me. I'm like, what do you mean I've been consuming something with maltodextrin in it for like the last
and
year of my
maltodextrin
life?
is sugar.
But it's trace amounts, so they don't necessarily have to put it on the label. I'm like, Well, that electrolyte
And
sucks.
the label will say on the front, no sugar.
No sugars, no added
In
sugars.
huge bold print,
Yep.
but then the first ingredient is the maltodextrin. So that's where it's like, again, maltodextrin isn't something that grows from the ground. Like, you've never heard of it, so that's the red flag.
If you have to say what is maltodextrin, like, most people know what cane sugar is. And honestly, like, sugar is sugar. Like, I eat sugar in my life. I add honey and maple syrup to so much crap. Like,
Totally.
love it.
Yeah.
All for it. There's time and a place. Obviously, not too much. Like,
Yeah,
so like
balance.
Yes,
And from a clean source.
exactly. Everything I have in my life, in my house, is organic, no matter what. I mean, but I can talk on honey about the organic thing. I talked to like a beekeeper the other day.
Tell us.
Like
Tell
a couple
us,
months
please.
ago. My husband and I were at like I think it's called the Peddlers Fair. I don't know what it's called. It's they host it over at like Lake Farm Park. Regardless, we're talking to this guy because we're trying to buy local raw honey from him. And Chad, my husband, goes, "Well, it's not organic." And he was like, "Honestly, let me tell you about the organic stuff." I'm like, "Okay, tell me. I want to know." And he said the bees travel within like a 5-mile radius of whatever farm they're kept on, right? Like, and then they come back. Like, it's usually a 5-mile radius. So if they're going to if they can't ensure that all the farms around them or all the land around them is not organic, they can't put the label organic. I'm like, well, then how do any of these people put organic on their label for honey? And he's like, that's a good question.
Yeah, I've gone down a rabbit hole
I
on
wanna hear it, I
organic.
wanna hear it, yeah.
Organic certification is very similar to other FDA approved certifications in this country,
Which sometimes are a crock of shit.
Exactly.
Yeah.
And it's like, it's definitely when you're looking at, okay, like conventional produce versus organic produce, it is such a safety change when you're looking at no GMOs, the less processing, all of the standards that you have to hit in order to get the label of
Yeah.
organic certification. But the caveat is that local is king. And when you can
Always.
learn that someone, small batch, even if it's not down the street, but it's small batch, is doing practices in a sustainable, safe, pesticide-free way.
Yep.
Some of these small businesses and the local businesses that are doing it right, small batch businesses, it would put them under to have to
They can't pay for the
that
label.
organic
They can't pay for
certification.
it. Yeah.
So the organic certification is pigeonholing and keeping the best brands out of getting the certification. So
insane.
I always say learn about, it's like conscious consuming, is like learn about the source. Local is king. There are a lot of farmers market vendors who won't have organic, but they're still a great option. So it's just learning more, you know?
I mean, local eggs, local milk,
Yep,
local
exactly.
meat,
Yep.
local. But I mean, I also understand that sometimes that's not an option for people, like
Totally.
the local aspect of things.
Totally. Yeah. But I always say too, is it's like, it does, I see how frustrating it is for consumers to go to Whole Foods and try to shop there. You know what I mean? Because like when it does come to organic, things are so much more expensive because it is the certification that you're paying for. So we do have farmers market options in the Cleveland area. Most cities have farmers markets that you can find.
Yep.
There's an incredible website called cornucopia.org.
Okay, don't know it.
And you can search for local milk, meats, all different types of foods.
Oh, that's huge.
And it will pull up whether it's the local farm in your space or where you can shop a local farm in your space.
Yeah.
Because not only are you going to get the quality, but the price point is so much better. And
Yeah.
like, to me, that's the future of being able to sustain a cleaner, healthier life, is us being able to support the real producers. And and vice versa, consumers being able to have the access without it being out of their price range.
Yeah, we have a dairy share. We like are part of
Badass.
a dairy share. So like we order all of our milk, our meats, our eggs, and
So
just pick it up
badass.
once a week.
So cool. Out by
So they supply a lot of people in our area. There's a couple pickups just
Yeah,
because we're on the
so
east side
cool.
of Cleveland. We
Yeah.
live in Chesterland, and
Yeah.
then I have a pickup in Chesterland. I know they drop off in Sugar and Falls and
Yeah.
a couple places right there. And
really cool.
like, I mean, I pick it up there, and they're on it. They do it every week. My only qualm is I would just wish it was like in glass cartons. And
I know. We can never have everything perfect.
I'm trying. I'm like, I won't complain.
Yeah, but
But-
no, that awareness is so interesting. And I think that's why I like to have the conversation, because it's not about perfection. It's about just being aware and making choices that are better than others when you can.
Try as hard as we can.
Yep, exactly. So sticking to diet, obviously reducing inflammation, which, by the way, inflammation, I was so shocked when I heard the statistic, but 95% of disease is not genetic. It is inflammation based.
I'm not shocked by that at all.
Exactly.
Not at all.
And when you really think about it, it's whether it's the food, the lifestyle, the stress that we're under, we're all so subject to these factors that if we're not aware of trying to reduce them on a consistent basis, like it would be easy for all of us to be sick.
You can do so much for yourself. I think about it, and like the amount of people that come in and are like, well, my dad had low back pain and my mom had low back pain. So?
Yeah.
Well, maybe it's like, don't get me wrong, you get your genetics from your parents. So maybe
Yeah.
your like build, your makeup, and
Right.
like the angle of this is maybe
Right.
that's very similar to your parents, but like not the way you do things, the way you move. Like,
And you can shift it. And I think that's so empowering, you know, because it's like as people who do have, you know, a history in their family of these things, there is an opportunity. Like you may not be able to change your gene makeup,
Right.
but you can change your lifestyle.
100%.
And that can significantly change the outcome that you have, which
Yeah.
is so freaking cool. So outside of inflammation, when it comes to diet, what are some other core tenets? We were talking a little bit about protein before we got started. That's
Yeah.
such like a buzzword, you know?
I
in
know.
the wellness
There's hot
space
ones. Yeah, there's hot topics right now. Yeah.
And it's just like everything. It's the basics of it, I think, is what we always have to stick to and not this like marketing scheme that comes with it.
Yeah.
So what do you recommend when it comes to protein in your diet? And do you think it's like the most important thing compared to other aspects?
Yes.
Okay.
So the way I recommend protein, the way I talk to anybody about protein is just first focus on how much. I don't love counting, like, the caveat, I don't love counting like carbs, proteins, fats.
I don't either.
I don't love encouraging it, but I think it can be helpful for one thing,
Okay.
and that's making you aware
Yeah.
of how much protein you actually take in a
Yeah.
day. I don't care about your carbs. I don't care about your fat. How much protein do you take in a day?
Got
and if
it.
you just count it for an entire week straight, because one day you could be like, all right, I'm already, and like do it honestly. Don't
Yeah.
change your diet. Eat what you were
Totally.
going to eat. Log it after the fact. Log it after the day is over and you're like,
Mm-hmm.
oh yeah, I ate this, this, and this. Then look at how many grams of protein you took in that day. And especially for females, it goes for males as well, but especially for females, you find that it is drastically you're underserving your body in terms
Mm-hmm.
of repair, just inflammation, inflammation from outside factors during the day. I said that, like the way you live your life, you're getting inflammation from those moments. And inflammation is a good thing. It's there to fix things, right? But it also can cause pain, discomfort, and mess with your hormones. So if you're not giving your body the proper fuel to repair, combat that inflammation, protein is necessary for that combatant, right? Like
Right.
you need it in order to thrive.
Got it.
I suggest you should be getting as many protein grams in a day as your body weight. It's pretty intense.
As many as your body weight.
Yes. And I weigh a lot. I sink. Trust me. You throw me in the water, I'm sinking. I'm a stone.
You're strong, though.
I-
Like, that's what we want to be.
But so I know that's drastic.
Mm-hmm.
But once you find out what your actual baseline is, try doubling it. So if you're getting 50 grams of protein in a day, and you'd be surprised, that's usually what I hear from women.
Yeah.
I'm like, whoa.
And you're saying so from an inflammation standpoint, like
Yes.
just like a regular lifestyle living.
And also
standpoint.
gains. If you want to look a certain way, if you want to feel a certain way,
Mm-hmm.
that's what I suggest.
So what about like trying to lean out while also building muscle? You recommend that same kind of amount?
Yeah,
Yeah.
for sure.
And if you're not hitting it, you're not going to hit your goals.
I don't
I
say
think,
no,
though,
no.
like that's my problem. Like
I don't
I
say
train
no and no,
really
yeah.
hard, but I ebb and flow with like eating enough protein. I know it.
Yep.
You know what I mean? Because
Yep.
it's like it takes planning.
And you said you used to be a vegetarian.
Correct.
So that's probably already a hurdle you have to overcome. Like, I am a meat eater. I am just like, what is the main component of every one of my meals? I'm like, I want meat and eggs with like Primal Kitchen yum yum sauce on it. That's all I want.
Yeah.
All the time. So I understand that's
Yeah.
not for everyone.
crazy about the type of meat that I eat. So to your point, it's like
Yeah.
you guys do the farm share thing. Like
Yep.
you have the stock so
Yep.
that you're able to do that throughout the week. And I think it is about planning. And as of lately, I've gotten a lot better with like doing my weekly grocery shop and doing a meal prep situation at the beginning of the week so that I have that to reach for throughout the week.
100%.
Because if I
huge.
don't,
Yep.
I'm not going to eat like random chicken from somewhere to go. And then I'm like, fuck, I'm like so far away from my goal.
And I don't feel good.
And I don't feel good. And then I'm training and I'm probably putting my body in too much stress without the recovery
I was going to say, and you
aspect.
said you train, you said, what, I don't know what your words you just used, but you train your ass off. Maybe
Yeah.
that's what you said. You can go back and quote whatever it was, but you train really hard.
Yeah.
And you're not seeing the gains that you're wanting to see, right? That is a huge thing too. I talk to people about all the time. One, you might be training too hard. Training too hard, underfueling, spiking your cortisol.
Yep.
Because training is good for you because it spikes your cortisol. However, too much training spikes your cortisol too much.
Yep.
And then your sex hormones are affected.
Yeah.
And then why am I retaining weight all the time? Why is my body not responding to the thing I want it to do? So you actually lose control in that moment. And it's easier said than done. I usually say do as I say, not as I do, because I can definitely find myself in the overtraining aspect of things.
Totally. Because it's so like mentally for me.
I mean, as a business owner, you know, like it's cathartic. Like you feel better. Like the endorphin release, you feel it's a stress reliever. It's good for cortisol. It's a blessing.
Finding the balance. So what do you, because like your goals, girl, like I've been watching your workouts and you are strong, have 2 babies and you're able to really get in the gym and also seems like stay in balance diet wise. So how often are you training throughout the week and what would you suggest to say like 37, 38-year-old woman who's trying to be strong and aligned like hours?
Keep in mind, I'm 35, so we're same age. Okay.
Cool. I'm 37, so I'm a little older than you, but like same shit.
We're same age. We're same age. And also my friend, she's older than me and she's more jacked than me. So like it is absolutely age. I've just learned more and more is yes, it affects things, but it doesn't. Like I'm better now than I was then.
Totally.
And it's all from knowledge. Like before I had my daughter, I would say, and I'll get to what I do now specifically, but it's been like an evolution of things.
Got it.
So like when I had my daughter, when I got pregnant with my daughter, I was doing primarily CrossFit and I love CrossFit. It's so great for like so many things. The camaraderie of like working out with people, that high intensity interval training, like you feel dead after. However, you do that too much, your cortisol spikes. And again, we're down the exact same road that we've been talking about. And I learned when I got pregnant, I thought that was really a blessing for me to learn about how to train through pregnancy and what is good movement. Just because I can do it, should I do it?
Right.
And I learned a lot in that moment about like core exercises and like engaging and pelvic floor, but like only so much. And I applied it to my training after I had my daughter. And that helped me recover. And it's like the whole entire get your body back, get to where you like, that's never what I was thinking. And it helped because when you're breastfeeding, so I nursed both of my kids for a year, your hormones are different. You're not really controlling your hormones. You're just trying to supply your body to give them and then also train correctly. So you're not giving your body too much inflammation so that your body can still create this. So
like you can't be depleted.
Exactly. So I ate so much all the time. But I made sure that all of my stuff that I ate was a good, healthy source.
Totally.
And even though I might have overeaten, it wasn't overeating because I was working out, I was feeding a kid, I was caring for another kid. And it was just making sure that those sources, you were
fueling your body.
I tell everyone, I'm like, I never will stop you from eating a lot. I'll be like, eat as much as you want. Just make sure it's the right stuff, right?
Really.
Except now I'm not nursing. I'm not pregnant, I don't think.
Heard it here first.
Find out in a couple weeks. Oh, no. So I'm not nursing. I am over a year and a half postpartum with my son. And I will say there's a drastic switch when you stop nursing. Like your body like re-regulates after about 3-6 months and your body changes during that time. The way I train is different. So I make sure that I do like at least 2 days a week or just like, I hate saying slow intentional, but that's kind of what it is. It's like a strength accessory stuff that I'm not like no high intensity interval training those days.
Got it.
I do a long-ish cardio and like maybe weighted exercise twice a week. And I do those on the weekend with my husband because I just we enjoy that time together.
What type of cardio?
So again, it's interval training. I would say longer though.
Like
so
a HIIT situation?
Sort of. So like, for example,
like that rower.
Yeah, I hate rowing, but I'll do it. It's good.
I saw you guys doing that.
And yeah, so like that, exactly like that. So like a long row, and then we do a small workout, and then we do a long row again. So it's like taxing in the beginning, taxing throughout, and then like, but 2 different types of, so we hit high heart rate really quick, lower heart rate, sustain it, high heart rate again. Okay. So it's like different ways to incorporate that. It's really I just don't do the same thing every day. Because if you do the same thing every day and expect a different result, that's insanity, right? So that, and then I'm also like, I'm 100% open about how I eat and what I do now. I intermittent fast right now. So I started intermittent fasting probably 3 or 4 months ago, once I was 6 months after breastfeeding. So I allowed my body about 6 months post breastfeeding to like kind of acclimate again hormonally, very regular, all like got my period back after breastfeeding and just became very regular. And then I was like, all right, I want to make another body shift. I want to see how, and it was really more for digestion. So I've had SIBO like symptoms for years, not undiagnosed SIBO, but essentially no matter what I eat, depending on what time of the day, I am bloated, uncomfortable. Why? And I think it was more along the lines I needed longer digestion windows. So no matter what, I stop eating before 8. So honestly, it's really helpful to have kids to do that because you have kids and you eat earlier. It's really nice. I'm like, so I'm eating by 6 and I don't eat until lunch the next day. So 11, 12 time lunch.
Every day?
Every single day.
What time of day do you train?
My digestion issues are
so much better.
So much better.
That's so interesting. Women, there's this fear around fasting for women as if it's like bad for your hormones.
I will tell you right now, there are ways to do that. So if you're fasting for longer periods of time, if you're always doing fasted cardio, fasted workouts, those are double stressors. So you stress with the fasted, you're stressing yourself by fasting, and then you stress yourself again by doing exercise. So there's certain phases of your cycle that can be detrimental to your hormones, right?
Which phases?
Kind of depends, but I would say more luteal. But at the same time, it depends on how you're doing it. And there's also, what is your window of fasting? It's not a one size fits all, right?
Totally.
Again, for digestion wise, this has been so helpful for me. It's been insane how helpful it's been for me in terms of digestion. My body comp also changed too. My blood sugar, I would say the way my blood sugar spikes is so much more regulated. It's insane. But I would never, ever, ever, if I'm hungry, because I don't wake up hungry at all.
Same. And I'm like force feeding myself and I hate it.
So I'll do like a greens drink in the morning.
Every day when you're fasting?
Yeah. So it's Sarah Raggy. It was Sarah Rag. I don't know if you've heard, I'm probably saying her last name wrong. I think it's Raggy. Wellness. Her greens drink is like specified for fasting individuals. So I'll do, before I do coffee or black coffee or anything like that, ton of water. I'll do my greens drink and then I'll drink a black coffee in the morning. And that is pretty much all I do. Yeah.
And then what time of day do you train?
It depends. So like on the weekends, I usually are fasted workouts, and then throughout the week are not fasted workouts.
Like later in the day.
Yeah. So like lunch or after. Yeah.
Got it. And will you usually like eat before you work out or after you work out, or both?
During the week, I'll have the thing is, when I break my fast, I always break it with protein heavy.
Got it.
Always. Like I shoot for at least 30 grams. That's on the low end. If not, I'll like, if I'm making a full lunch when I break my fast, like say on the weekends, I'm doing like 45, 50 grams in that little scenario.
And then right after you train, you'll usually do more protein?
Yep.
Cool.
Yeah.
That's really inspiring. So I went to this health conference and every single functional medicine doctor raved about fasting and how like intermittent fasting is just like truly one of the best resets we can give to our bodies. And of course, like you said, there are certain times, there's certain people, but even if you just are able to incorporate it like a couple times a week, it gives your body this break that can be so valuable.
Digestively, yeah, for sure.
Yeah.
And I think you got to look at it from a blood sugar standpoint as well. It's so good at regulating your blood sugar and the way you respond and like cravings and stuff like that. Like in the way, like it just, there's the reason they raved about it is because there's so much research on it. I'm not in a caloric deficit. I will say that. When the food I eat and the window I eat just as much food in that window as I would if I were eating throughout the day.
Yeah, you're getting your body weight in protein in that window.
Exactly.
Yeah, that's badass. Okay, I might like I said, I was doing that a bit and then I was really liking how I was feeling.
Yeah.
But I just kind of like go back and forth with it, and then I'm traveling and then I'm like, enjoying my breakfasts on the beach.
But you have to be able to do that. There's a time and a place.
Totally.
I will say it's actually helped with traveling.
Yeah.
So like, when you travel and you feel like your gut is all messed up, like you're like, I was in the air and then I didn't eat until 2 hours after what I usually do. And then you just feel dysregulated anyways. Intermittent fasting has actually helped with that dysregulation. So like I'll travel, but since I already knew, like since I'm so regular in that moment, it has helped take a little bit of the traveling dysregulation off.
Absolutely. I'm no medical doctor by any means, but I just share a lot of my genuine routine.
Yeah.
And I have the pulse of other women in my demographic and what works for them. And I've made a lot of connections through it. And when I was doing more of the fasting and feeling really good, I had so many women tell me the same. They're like, girl, like I've done it too. It's changed my life. Have so much more energy. I sleep better. I think there is an opportunity for us to not be scared of it as women. And especially, like you said, if we're in this stage of life where we are in alignment and balance and giving your body a break in that way. And I think intermittent fasting can be cool because it's not this like big ass, I'm going to do a water fast for 5 days. That's so challenging. It's just shifting up your routine and having your eating window be different than your break window, giving your body a time to reset and refuel.
Agreed. Yeah. It's like it's truly dependent on the way your hormones react. And like I will say mine are more regulated than they've ever been. I know the exact day it's coming. I know when it's coming. Yeah. I know when I'm 10 days out based on how my body feels.
Yeah.
Like I'm like, I bet you if I look at my app, it's going to tell me I'm 10 days away from my period.
I know. I can't recommend enough like getting on an app and learning about your period.
Yeah.
What's the app you use?
Flow.
I used Ovia.
I've heard all of them.
Either or,
Yeah.
same thing. I just think that's such a valuable way for women to start to understand their own body alignment.
For sure.
It's that simple, and it will tell you the day. You just log your stuff, and it gives you some insight on what that means. There's a really good book called In the Flow by Alyssa Vitti. So good. And when it comes to like breaking down each one of the stages of our cycle and how you can eat, like symptoms say like breast tenderness shouldn't be happening if you're in alignment. And there are ways that you can eat and align your body and your habits around your cycle to reduce cramps, pain, things like that.
100%. Yeah.
So as women, first off, in general, how often do you recommend that people get chiropractic adjustments? And then as women, is it the same throughout our cycles? Does that change? And then pre and post pregnancy, does that shift?
Yes to all those. Everything shifts. Again, everything's tailor-made to the individual. I will say if I had to make one like blanket term to everybody, just assuming that they don't have an active issue going on, I would say every 4 weeks maintenance. Just making sure things are going the way they're supposed to. Maybe things were about to fall off the rails and we just keep them back on, right? So that I just say 4-week maintenance, that's a blanket.
Got it.
For women, prenatal, I usually see as long as I also say with prenatal care, so pregnant women, I say pain is common. It is not normal. Just because you're pregnant and your mechanics are changing does not mean that you're supposed to be in pain the whole time. Very common, not normal.
People just assume like,
I'm pregnant. It's just like what
I'm supposed to be living in hell.
No, disagree. Don't get me wrong. Last 4 weeks, and I tell them, I'm like, at 36 weeks, I'm sorry.
And there's probably a difference between like being uncomfortable and being in like awful pain.
Yes, exactly. Just like when you're working out. When you're working out, I'm like, there's a difference between good pain and bad pain. Like pushing through something and being like, wait, I think my hip's going to break off. Like maybe you should stop doing the movement. So for prenatal care, I usually see them along as long as there are no symptoms, like no pain symptoms like sciatica or very common in pregnancy. I usually see them along with their OB appointment. So once every 4 weeks.
Got it.
And then closer towards that due
and
date.
It's the same adjustment.
No, I specialize in what's called Webster protocol, which is a more of a ligament and sacral, so sacrum-based specialty. It was founded based off of making sure baby's position is the best it possibly can be for birth.
Cool.
But I'm not allowed to say that I manipulate baby position because that would like insinuate that I go inside and like change the baby's position. I don't do that. I just do a lot of ligamentous work, a lot of soft tissue work, some alignment stuff to make sure that the woman carrying the baby is in the best position for the baby to be in.
Got it.
And that's more that my prenatal care for that. And soft tissue work. I have so many pregnant patients that work out that still have, I hurt my shoulder yesterday. Okay, then let's treat your shoulder. So that's an active issue. So if somebody's in an active pain issue, active injury issue, depending on whether it's acute or chronic, dictates their care plan. How are we going to take care of you in this moment?
Absolutely.
If you're in a lot of pain, let's see you a couple times this week and next week and let's get you down and then let's figure out how to keep it that way. So,
and do you recommend weight training throughout pregnancy?
Yes.
Got it.
100%.
Cool.
I recommend weight training forever for everybody all the time.
Yeah. Amazing. Yeah. It's like prevention.
People give the analogy of oil changes. You change your car's oil every
sense.
whenever. I love analogies and I hate them because I'm like, that's once every 3 months or I don't do that. I don't know what that is.
Totally.
But it is. It's like, let's lubricate the body. Make sure the body it's an engine. You're 10 what's the Tin Man and,
Yeah.
and Oz.
Yeah.
We got to make sure that things are moving.
Absolutely. So 2 other like things that I really want to talk to you about. I mean, it's a few things, but like in general. So like supplements.
Yeah.
Are you a fan of them? Is it something that you think is important in people's daily lives?
Yes. First and foremost, we should be getting all these things through our diet, yada, yada. Most of us are not digesting what we take in as well as we possibly can. So I think over supplementing those things is a really good idea. And then also finding holes in your diet. If you are vegetarian, if you don't like red meat, if you like, because there are things like this that people don't like to consume, and that's fine. I'm not going to change your life, but you still need these things in your body for your body to function optimally. So
Absolutely.
I am not a huge supplement pusher because myself, it's hard for me to like get on a regimen and like stay consistent, compliant. But for everybody that comes in, no matter what, I suggest magnesium, glycinate, whatever the heck you want to say it. Citrate is also good too, but there's different forms of that can like help digestion versus like muscular recovery.
Got it.
Vitamin D, because you live in Ohio, and on average throughout the year, you're not getting enough of it.
Totally.
Fish oil, so omega is just like, and that's just an inflammatory regulator. Like instead of taking NSAIDs and Advil all day, every day. And then those are the only ones that I'm like, here's your little, even if you're happy, healthy, come in for wellness care. I'm like, here's your little pack. You should take these.
Yeah.
But there's so many other things you can add on top of it. Protein. So like collagen protein. What do you know? Like adding it into your morning. I told you I take it with coffee because I know that I'm getting it at that moment. And it's no matter what, I'm going to have coffee.
Totally.
So if I add it to that routine, I know I'm going to take it in.
Absolutely.
But I mean, there's so many other supplements that I could suggest. And like, there's a immunity supplement, there's and then we can go into the peptide gain. Those aren't supplements, but they're.
Yeah. What are your thoughts on peptides? Because it's
God,
a big topic in the
Buzz.
wellness world right now. It's like known as being like the cure for everything.
Okay. Yes.
What exactly are they, and what are your thoughts?
So I'm not a pharmacist. I'm not a medical doctor. I'm not an MP, a nurse practitioner. I do not prescribe these things. I can tell you I suggest them because I know their uses and I know how they can help so much. And as of now, there's no research that is saying, hey, these things might cause this stuff down here but again, take it with a grain of salt because they are new, to be fair, or new that we know of. And the FDA doesn't want to regulate or doesn't want to approve them because they're not making money off of something that's actually making people better. Right.
Of course.
So I said it. That's true.
It's true.
So like for instance, you've probably heard of BPC 157. BPC 157 is a very like it's good for lowering body inflammation.
Got it.
Right? But it's primarily gut inflammation. You can re-heal gut tissue. But also when you lower body inflammation and allow your body to heal, it's a natural healer. So if you have an injury, it can help that injury heal quicker and lower body inflammation all at the same time. So you just feel better all the time. So
is it something people would do on a consistent basis?
yes, you can go through like
And like, where do you get it?
periods of it. So we actually started offering it like peptides and peptide uses at our office. We're in the regenerative medicine now. Love it.
Very badass.
Yes, our nurse practitioner, Sarah Williams, she's unbelievable. Like, for instance, I, for the first time, did NAD. Have you heard of NAD?
Yes.
So for the first time, and I'm going to be going on a 3-month trial of it. So any day, should get to my house maybe today, tomorrow. Fingers crossed. Try it for the first time the other day. And I don't know how to describe, the best way I can describe it is in an overstimulated world. Like I'm an overstimulated person. I got my kids, I got work, everybody's asking me something. So sometimes you just like feel like you snap and you're just like, sorry.
Tension.
Yes. And that anxiety, like kind of like just the underneather.
Yeah.
That threshold was lowered. Like I would say my mood.
And it's an injection.
You don't have to, but
Yeah.
sub-Q injection, probably best way. I did a microdose. I will be doing microdoses, sub-Q injections of NAD.
So interesting.
5 days a week.
NAD is another thing that health conference that everyone was raving about.
I mean, it's your young peptide. Like it makes you like truly my energy. I wasn't like wired, not like I took a shot of espresso. It was like my eyes were open. I'm
like a calm clarity almost.
yes.
Yeah.
And like a better mood.
So cool. Yeah, NAD is like the anti-aging king.
I can see why.
What's interesting is it can make some people flush, the pill form.
It can.
And the pill form makes me flush.
And sub-Q.
Would the injection?
So sub-Q, so that's why I like the microdose. I will say I understand exactly what people are talking about in that moment. Some people don't like it, especially if you've ever heard of an IV, an NAD IV. Wouldn't suggest it. Don't get me wrong, you get benefit from it.
Right, and it's just like whatever.
It can be pretty intense.
Yeah.
Like, I mean, vomit. Like, so it's the overall full body flush. I did feel that, but like, it was kind of like I took a shot of espresso in that moment.
Yeah.
That's what I felt.
I also think it matters like what you're having around it. When I take it without any other meals or anything at the time.
Fasted.
Yeah, fine.
Yeah.
I took it once, like right after having something that had like hot pepper in it.
Yeah. Freaked out.
Having an allergic reaction. I'm like, ChatGPT, like, what's wrong with me?
No.
And it was fine in 20 minutes.
I was going to say 10, 15 minutes.
Yeah.
Like, I also took it fasted, but that was sub-Q. And I just like, literally, I was just like, I get what you mean. And now I'm good.
Yeah.
And it was fine.
Totally. And it's like, again, benefits probably outweigh it. So, okay, so NAD and then any other ones that you think are like so is that the only one you're going to do, or are you going to do the BP, whatever?
BPC 157. So that will be, I'm going to take the Glow peptide, and it's like sorry, I hit the thing. It's like a trifecta, and there's like, it's like a mix of collagen booster and stuff like that's good for your skin. Like,
Got it.
I'm going to do a 2 to 3 month of that and a 2 to 3 month of NAD. Stop, see how I feel. And also, I won't do these things when I'm pregnant because there's just no research on it, really.
Right.
'Cause nobody wants to do
And you wanna be
research on them.
clear. So would it be a situation where you'd have to come to your office every time you get it, or does it like come to your house and you inject it yourself?
Comes to your house. So you see the nurse practitioner. You want to know what your goals are. You want to do blood work. Like, let's make sure that this is fine for you. And then essentially, if that's what you want, you get the prescription. It's shipped directly to your house. And if you're okay with doing your injections on your own, she can show you, or I can show you. Honestly, it's the easiest thing in the entire world. They're just insulin and needles, and you just do your injections at home.
Wow.
So easy.
Sign me up. I'm going to try it.
I know, I'm telling you, it's freaking insane.
What are your thoughts on GLP-1s?
Okay, so I want to say in the beginning, when all of this stuff started coming out, I was kind of a hater.
Yeah.
I'm like, people just aren't doing the work. Like, what are you talking about? But now I'm okay with reasons behind using it in the beginning. I think consistent long-term usage when you're already at a very healthy weight and your blood work is fine, I don't think is necessary. I will say that. But for like a Kickstarter, when people are in like, there's moments when you're like, I just need something to give me motivation. I don't know. It's really hard when you're down in the dumps to get out of that. And then maybe if this gives you that kickstart, that hope, you lose 20 pounds and you're able to move again. Like, you couldn't move at all because you were so in a moment that you couldn't be. And then you use one of the weight loss peptides to help you with that. I'm fine with it.
Yeah.
Totally.
But
you have to strength train.
Yes. I think it comes back to everything, which is like, I always say, I'm not against antidepressants.
Yeah.
But what I am against is people trying to have a one size fix. Like, if you take the antidepressants but don't also do the other things to change your lifestyle, you will only see that short-term healing, not the long-term sustainable healing, where it's just like how I feel about GLP-1s. It's like, if you can use it as one of many tools to get you in a healthier lifestyle that you wouldn't otherwise have, I think that's so powerful.
Totally,
But it's like, you can't lose sight of these things, these lifestyle changes that are so valuable and important to do consistently, like weight train, eat enough protein, or long term it could be really detrimental.
Yes. And then like, it's like making sure resistance training, still eating the right sources. So like, I know it can lower threshold for like appetite and stuff like that. Yeah. When you do eat, you're not just eating crap.
Yeah.
And then doing nothing. That's one thing that I'm like, no, that's not a good way to use it.
Totally. Mentally, what do you do to keep your zen? You know, as someone,
I work out. I watch trash TV.
Honestly, sometimes it's relaxing. I mean, you do what you gotta do. I think that's the area that I've really dialed in on in the last couple years, because I've always been, like I said, like an overly high achiever. And I think there's only so much that you can do physically if you're not truly able to get your stress levels in alignment. And so that looks different for everyone. But I think especially as a mom, like, are you able to take time for yourself, and what does that look like?
My time for myself truly truly is my workouts and sauna. When I sit in a sauna for 15, 20 minutes, I'm like, this is everything I need in my life to make me better for that day.
Yeah,
For,
and you're like finding peace and quiet.
yes,
and
and
calm.
way kids can't go in the sauna with you.
Yeah.
I mean, I might have my kids literally running around. You
They're,
might
like,
see
at the door.
it was like they're in the gym running around as I'm like, no, don't do that. Like as I'm running. So you see that's on my social media, but they can't come in the sauna with me.
Yeah.
And it's like, this is safe space.
Yeah.
I am alone.
Yes.
Or even when my husband's in there, we're able, like, even if we're talking business in there, like it's like a meeting, it's still,
it's like a calm.
yeah, it's like pretty much.
environment.
And then, like I said, I wasn't joking when I said watch trash TV, sit on my couch, kids are sleeping, watch trash TV, drink a coffee, alone.
Yeah, you
nice.
just like need a moment for yourself sometimes.
I should meditate. I would be.
It's really powerful. Like actually changes gene expression.
It's wild
Yeah.
because I know so much. Like I hear so many good things. I just don't know even how I would start.
Yeah, well, so it's like taking that space. I was the exact same way when I went to my first 7-day Dr. Joe Dispenza retreat. I had probably meditated for tops 15 minutes tops, and then I meditated over 40 hours that week.
Good
So
Lord.
it like when I'm into something, I'll just like throw myself into the deep end.
Yeah.
But it changed my life. I was a complete pothead before I went. I would smoke every single day, like all day. Never touched weed again after it because I just felt this clarity and this peace that I was never able to get before in my regular life.
By meditating.
By meditating.
Oh my goodness.
And I mean, those 7 days were definitely like when you do have to sit with yourself, it's hard. It's really hard at first because there are in yoga what we call samskaras, which are basically these unconscious stressors that want to come to the surface. So whether you're sitting there and you're like, my foot is like numb.
Yeah.
Whether it's that or whether it's like, oh my God, I have all these things to do all day. Like those are your ego mind taking you away from your true center. And so even if it's 15 minutes in your sauna, sitting in silence and you're just focusing on trying to keep your mind from running, every time you do that and you come back, even if for the whole 15 minutes, you're just like, fuck, I'm like,
that would be
it
me.
strengthens you.
That would be
and
me.
then next thing you know, you're finding, for me, I used to be a very reactive person.
Yeah.
I would get like hot quick.
Me too.
I
need to
wouldn't
do
even
this.
recognize like the way that I can handle challenge and conflict now. It's crazy.
I need to do this.
Yeah, and like you're in your sauna is a perfect time because it is hard to like find the consistency, especially if you have kids and you wake up and you're getting them going and everything.
Yeah.
But it's like that, and I always say it doesn't have to be an hour-long meditation every day. If it's 10 to 15 minutes while you're already in your sauna, habit stacking, like take your beat, do guided or just do silence, and over time it will yield incredible results.
Gosh. Yeah, you know what? That'll be
And
my action step.
As a practitioner, it would blow your mind. And the reason why, like, I was never really, I mean, I am like a spiritual woo-woo person for sure.
Okay.
But I am like, really practical and I'm very science-based. I was in a chemistry field.
Yeah.
So I have to know that there's going to be results for the actions that I'm putting in. The reason why I loved the Dr. Joe Dispenza retreat and his content was because it was over 40 hours meditation. The rest of the 40 hours of that week was science and lecture. And all of the data that they are gaining doing real live testing of people and how in those 7 days, their biomarkers that change.
That's crazy.
It's so cool.
That's neat.
So he's really trying to get it into modern medicine.
Okay.
And I think like as someone like yourself who's very practical when it comes to health, it's like, okay, wow, like this is actually doing some major shit for decreasing inflammation in your body.
Okay.
Yeah.
Hey, I'm for it.
Yeah.
Yeah.
And like, you're already doing the sauna, so like you got that's your time.
I just know I'm going to be bad at it.
It is. And I am too.
I'm a competitive person.
Yeah.
So knowing I'm going to be bad at something, I'm into it.
But just imagine how good you're going to get at it.
I have to try really hard.
Totally. So speaking of biohacking, like, is there anything like, you think is a misconception or like overhype with some of this shit? Or is it kind of like, there's potential some value in everything we see out there in the wellness world?
I think there's a lot of value in that. I think social media is like, again, with AI, it's like a blessing and a curse because it's just making you more aware of it. At least my algorithm is.
Totally.
I think there's a lot of validity in a lot of it. I think there's a hierarchy of what's the better than others.
Yeah.
But I wouldn't say there's anything I'm like, that's crap. That's just stupid.
Yeah.
Like, I will say there's not in terms of biohacking. I will say like in terms of like offering advice, and especially in the training realm, especially for women. Women look at people or they see a girl and then she's doing something and they want to do it too.
Yeah.
And here I am, like I post stuff and I'm like, okay, well you can do it too, but maybe you shouldn't do it. Maybe that's not something for you. I think there's women that shouldn't necessarily be giving advice on something or showing women's health exercises, especially in the prenatal or postpartum realm for people.
And saying like this works for everyone.
That I think can be dangerous.
Yeah.
And potentially harmful. And also it can be kind of degrading for some women that don't necessarily need to be doing that or can't do it.
Yeah.
I think there are some really good ones though. Really good
Totally.
ones. And it's hard to weed that out.
Yeah. I think something that you said multiple times throughout the episode today that really stuck with me and hopefully sticks with the listeners is it is not a one size fits all. And I think it's so important for us to remember, especially with this oversaturation of information out there that and consumption in general, that every body is its own unique chemistry.
Yep.
And it is not going to be the same for you that's going to work for me. And there are definitely threads that we can find that are statistically proven to provide benefits, but then there's also a specific routine that you can find that is most valuable for your body. So stick to your intuition.
Yeah.
You know, and try to follow that as much as possible. And I love though that you walk the walk when it comes to showing your followers how you're living your life.
Yeah.
You know, and it's like nothing that's crazy clinical. It's just genuine.
Yeah.
And I think that's where real experience can be so helpful when we share it.
I wish more people would just show what they do normally rather than like, yes, it's really pretty when you make it pretty, but people just want real life advice and experience.
And it's so powerful when we share it and connect. So where can people find you?
You mean like social media wise? I honestly, it's bad because I'm not sure if this is right, but I think it's dr.mary.t, maybe?
I think so.
Yeah.
Yeah, we'll put it underneath in the show notes so you guys can find her.
I told you I don't care enough. I'm sorry.
Love about you. And then what about Code Chiro?
Code Chiro is just at Code Chiro. Code Chiro you can find everybody through there. We have so many cool things, free information. Our website even has like an entire plethora of movement exercises you can do. You can just go to shoulder and like see all that. Like, so like our YouTube channel, we just
resources.
put just so much crap on it. Yeah.
Love that. And then if people want to book an appointment, they go to Code Chiro.
Yeah, they can do the website. They can DM us. Like, we'll get you on this. We'll figure it out.
Amazing.
Yeah.
Well, thank you, Dr. Mary, for being such an inspiration and coming on the pod today.
Thank you for having me.
So awesome meeting you.
Yeah, you too.
Can't wait to keep learning from you. If you guys like this episode, please like and subscribe on YouTube, Spotify, or Apple, or wherever you listen to podcasts. For more information on living clean and consciously, go to TheCheekyClean.com and follow me at TheCheekyClean. You can also buy the collagen, which is Dr. Mary approved, at ConsciousCart.com. And we'll see you next week.